Central venous access devices. This care plan will address risk for injury, impaired catheter function from a patient and interventions. Check the description below for your free care plan worksheet. This will be useful for writing down rationales provided in this video. Before we start, let's have a general understanding of central venous access devices. Central venous access devices include implantable ports, peripherally inserted central catheter, tunneled and non-tunneled catheters. What is a central venous access? A central venous access devices are indwelling catheters placed in large vessels using a variety of approaches. These catheters or devices are indicated for total parenteral nutrition, blood administration, intermittent or continuous medication administration, especially long-term antibiotics, vesicant agents, or chemotherapy, multiple blood draws, parenteral fluids, and long-term venous access. Central venous access devices are beneficial for patients who receive IV therapies that require the hemodilution from the blood flow in large central veins. What are the safety risks when using a central venous access? Mechanical problems in central line, associated bloodstream infections are serious complications related to the use of these catheters and ports. According to the Joint Commission, central venous catheters are the most frequent cause of healthcare-associated bloodstream infections. The main reasons a patient is at risk for injury, impaired catheter function is because of the following. Mechanical impairment such as clotting of catheter, catheter break, migration, and/or pinch-off syndrome. As a nurse, here is the expected outcome we need to achieve. Patient's catheter function is maintained, as evidenced by patency with acceptable two-way function. As a nurse, we will need to assess the following. Inspect for catheter integrity. Early assessment facilitates prompt intervention and reduces complications. Verify the type of catheter inserted, its length, and the location of the tip. This assessment can be done by review of documentation in the patient's medical record and confirmation by chest X-ray study. Newer catheters may utilize magnet tip locators or electrocardiogram verification. Check for patency. Observe gravitational flow, especially with transfusion of blood products. Catheter patency is confirmed by the ability to run an infusion, withdraw blood, or flush the catheter without resistance. Observe for kinks, note any leakage. Kinks will compromise the integrity of the system. Fluid leaking from insertion site can signal catheter rupture. Now let's go over important nursing actions to provide the patient. Flush the catheter according to established institutional policy and procedure and manufacturer's guidelines. In general, the catheter is flushed at the end of every blood drawing procedure, at the completion of each IV solution and blood product, and before capping the catheter. Flushing prevents the catheter from clotting. Each catheter has specific requirements for routine flushing. This may include flushing with saline, heparin, or a routine flush with a thrombolytic enzyme such as alteplase. Single-use flushing systems should be used, ideally with a 10 ml syringe. Avoid administering incompatible solutions and medications. Infusion of incompatible solutions may cause precipitation within the catheter and eventual obstruction. The nurse consults drug and solution compatibility charts before administration. The nurse can consult with the pharmacist if the charts do not provide sufficiently clear compatibility information. Use mechanical 4 pumps. Infusion pumps prevent dry IVs and backing up of blood into the catheter. Appropriate use of safety-enhancing technology minimizes the risk of harm to the patient from clotting of the catheter. Troubleshoot the catheter and port for common problems such as sluggish inflow, inability to draw blood. These nursing actions maintain function of the catheter and reduce harm to the patient when a non-functioning catheter must be replaced. Obtain a prescription for the use of a thrombolytic enzyme, such as alteplase or alternative agent for the clearance of an occluded catheter or port if other measures to restore catheter function are unsuccessful. Clots and precipitates in central venous access device are a relatively frequent complication. Alteplase is used to dissolve blood clots, and hydrochloric acid or sodium bicarbonate can be used to remove drug precipitates. Notify the physician of suspected internal catheter damage. catheter replacement may be indicated. That's it for this video. Check the description below for your free care plan worksheet. This will help you retain information for passing exams. Good luck with your studies, future nurse.